Hi, Dr. Gary here, Dr. Gary on the road. We sell dental practices throughout the United States. Today's topic is going to be obligations of the seller for a 30-day supply requirement. This is something that will often be in your contract. We're going to talk about this. It may seem like a simple thing, but if there isn't 30-day supply, you would be shocked how angry the buyer is going to get. Anyway, so it's Dr. Gary. We sell dental practices. We sell them throughout the United States. The name of our company is Dental Practice. DentalPracticeGuide.com is our website, Dental Practice Guide. Name of the company is Healthcare Practice Sale, LLC. And our phone number is 201-663-0935. 201-663-0935. Website, DentalPracticeGuide.com. Our phone number is answered 7:30 in the morning till 9:30 at night. We answer every day except Christmas and Easter. Call us. We're there. We'll take care of everything, and we'll get right on top of it for you. If you need advice, we'll help you. Whether you're a seller or a buyer, if you're a seller and you're selling a large DSO, want to sell to a large DSO, we get the DSOs to pay our commission, so it would be commission free to you. And often when you work with me, we will often, based on criteria, get your legal fees reimbursed at closing. The information you're about to hear is for entertainment, not for legal advice at all. So anyway, in every dental contract, whether you're selling to a DSO or private or whatever, even if you have a very small office, there is a clause in the contract, and it should be in your contract. Hopefully you're going to use a dental attorney. There's a clause in that contract that says it is a requirement that you must leave a working 30-day supplies in the office. In other words, what your consumables are. Cotton rolls, gauze, impression material, disposable bibs, all these things. You need at least a 30-day supply to be left in your office upon closing. So you can never really some doctors sometimes try to cut back, save a little money so there's hardly any supplies left when the new buyer takes over. I know it may seem like a small thing to you, but if that buyer gets in there, I've seen some buyers create lawsuits because there wasn't enough supplies left. I mean, they got really angry. You don't want to do that to a buyer. So I know it's hard to be spending money and you're not going to be utilizing some of these and you try to cut back. You really can't cinch on it. You want to give an adequate 30-day supply. And also, closings are hard to predict when it's going to occur. We think it's going to occur on a certain date, and then it gets delayed. It generally never happens sooner than you think. It's always later than you think. So those supplies, you've got to keep it up. Keep it up for yourself so you can keep practicing is what you should do. And start any big case. Don't even hesitate about starting a large dental case because you don't know when the thing's going to close anyway. You could lose thousands of dollars waiting for it to close and not starting big cases. Don't worry about it. Start the case. But leave those supplies. An adequate 30-day supply of consumables have to be left for the new buyer. Never chintz on this. Never be cheap on this because buyers will get, I can't tell you how irate they are, and they will be if they have to start ordering all these supplies. Often they don't get, they're just starting out. The bank will give them some working capital, but they weren't planning on a large expenditure in the first month. Now, certainly, there's going to be certain supplies that they want that you don't utilize, and they're going to be ordering for themselves. But you've got to just realize the supplies that you order, keep ordering them, keep it stocked, keep the 30-day supply. It'll come in handy for you if the closing doesn't occur when you think it's going to occur. And the buyer will be very pleased because at least for 30 days, approximately, they'll have enough supplies. They don't have to spend money. They don't want to spend money, but they didn't think they would have to. So please try to accommodate them, help them out, and I think it's going to work out great for you. But just always remember that. All right, you don't want to start off the relationship that you just sold the practice and he's upset. Remember, that buyer has to kind of stand behind you. You know, if there's any work that you did or questionable, or a patient left, it's only temporary in his mouth and it wasn't your fault, or the patient didn't return for a periodontal therapy or hygiene, you know, you want a buyer that's going to stand behind your work, is what he should do. But you want a happy buyer. It comes down to having a happy buyer. So, and also you as buyers, you want happy sellers, but you want it. So remember that 30-day supply must be maintained. It's in the contract, it's not negotiable. Just, you know, be honorable and take care of that, even though if it costs you a little extra money. All right, thank you.